Health experts and policymakers are calling for urgent measures to make healthcare safer for the most vulnerable patients, newborns and children. They warn that unsafe care continues to cause preventable harm in maternity wards, neonatal units and pediatric settings. This not only in Kenya, but across the region. Elizabeth Atieno reports.
According to a Lancet report, previous aid sanctions from the year 1990 to 2019 increased the annual maternal mortality rate by 6% and increased child mortality rate by 4%. The US said funding cuts are projected to cause an additional 14 million deaths by 2030, with more than 4.5 million of these deaths occurring in children under the age of 5. Additionally, 500,000 deaths will be reported due to loss of family planning services and 1.8 million stillbirths also anticipated.
Funding for maternal health may drop by 23%, child health by 17%, and family planning by 34%. These cuts threaten to unravel decades of progress and disproportionately harm women, children, and adolescents.
African countries have been urged to focus on attracting investment and mobilizing domestic resources as a cornerstone for building resilient health systems. This comes in light of the fact that in 2021, 27.9% of Africa's child health expenditure was financed by governments, 29.9% from external sources, and 42.2% from private financial resources.
Our collective political action of South-to-South knowledge exchange, which have facilitated an acceleration of reduction of women, child and adolescent mortality over the years have been significant.
The discussion on enhancing maternal and child health was further amplified by health stakeholders in Kenya, who emphasized the urgent need to prevent harm in neonatal and pediatric care. They highlighted the continued vulnerability of newborns and children to risks and complications resulting from unsafe healthcare practices.
Medication errors cause more than one death a day, right? Leading to approximately 1.3 million injuries per year in the US, with a total cost, and this is from WHO, $42 billion annually. Pediatric patients are 3 times more likely to experience medication errors more than adults.
And in UNICEF's Eastern and Southern Africa, newborns account for more than 40% of under 5 deaths, showing that the first days of life remains the most dangerous.
Speaking during the World Patient Safety Day Symposium, PS for Public Health Mary Mudhoni said this year's theme speaks directly to the heart of Kenya's healthcare mission, which is to protect, to nurture, and to ensure that every child's journey in life is safe, healthy, and full of potential.
We have made tangible progress. One, by investing in the primary healthcare and rolling out our community health strategy. Secondly, strengthening the primary healthcare networks to bring services closer to the people and to the family.
Healthcare experts have also agreed on the importance of strengthening early detection systems for high-risk conditions in newborns and children, while also addressing policy and resource gaps that continue to leave maternal and child health units vulnerable to preventable diseases. Elizabeth Atieno, TV 47.